So many of the diseases that we are treating as doctors today has its basis in too much stress compared to our capacity. And it will lead to a chronic inflammation that will manifest itself in all the different organs of the body. So it's the same root cause of a lot of brain disorders, neurodegenerative disorders, heart disease, cancer, autoimmune diseases, and so much of what we are struggling with. So it's a really, really important thing to have control of. And the really good thing is that now I see you have a Whoop band on your wrist. And Cristiano Ronaldo, the soccer player, says that this is like having a doctor on your wrist. And I totally agree.
I'm Garrett Salpeter, and I believe that the most powerful and transformative way to help people recover from pain and injury, heal from trauma, and reach their highest levels of fitness and performance is to focus on the nervous system. In this podcast, we'll share knowledge from the frontiers of neuroscience and inspirational stories of how applying that knowledge has empowered people from all walks of life to heal, adapt, and grow. Hello, NeuFit Nation, and welcome back to the Undercurrent podcast. Today, we're going to have a deep dive into a topic that I love, and that's heart rate variability. And my guest today is Dr. Torkil Færø, a Norwegian physician who has developed a wonderful expertise in heart rate variability and how to apply it to help with stress, with health, with performance. He's been a physician for over 25 years, working both in general practice and emergency medicine. And his book, The Pulse Cure, came out just about a year ago from the time we're having this conversation. And he's become a real thought leader in the area of how to understand heart rate variability and how to apply it as a tool for getting real time or quasi real time within the span of a day information that we can use to really make meaningful changes to improve our health. So I'm really excited. Torkil, thank you so much for being here. And can you introduce yourself a little bit and let us know sort of your origin story, how you made this segue from the type of medicine, more traditional types of medicine you were practicing, and really went so far in this direction of focusing on heart rate variability.
Yeah, nice to be here, Garrett. And yeah, from dysfunctional medicine to functional medicine, huh?
That's a good Twitter or X quote right there. Very good.
That's right. Yeah, so I'm a normal doctor, normal general practitioner, emergency physician, as you said. I've been examining more than 50,000 unique patients in more than 100,000 consultations throughout these years. My change and the reason for the Pulse Cure happened now about 12 years ago. My father died at the age of 73 of cancer. And I started to look in the mirror, looked at myself, understood I was 40 pounds overweight, had a lousy lifestyle regarding health. I was adventurous. We were on our circumnavigation with our own sailboat going around the world. When my father died, we had to pack up the boat in Panama by the canal and just leave it and go home, watch him die, for 3 months. And then I saw that, okay, what I learned in medical school did not teach me how to create health, only how to categorize and diagnose diseases and find out what is the treatment for these diseases. So creating health was not in our curriculum, really. And I started kind of the medical study part 2 in my own leisure time. Understood that there was so much we now knew about inflammation, about insulin resistance, about the role of sleep, diet, movement, alcohol, cold exposure, everything that is now well known. I'm sure you've had lots of podcasts discussing these subjects. And somewhere along the way, I understood that the wearables that we are using that can track heart rate variability can monitor these changes. So whatever good you do in the right direction when in regards to lifestyle, it will affect your heart rate variability positively. Whatever you do that hurts your health will be detrimental for your heart rate variability. So we have these wearables now that can be like a dashboard for our physiology and a window into our autonomic nervous system. And that is a system that has been largely overlooked by the medical society, by us doctors. And along the way, I understood that the autonomic nervous system is a basement, is a fundamental thing of our physiology, and we need to get it aligned, balanced, to have a sustainable health. So I started using ECG monitors, and then I had the Garmin watches, and so on. And then I wrote the Pulse Cure, the book on how to use these different lifestyle strategies compared to what we can see on our watches. And it's been just an incredible success in Norway, selling what would be in the US around 2.5 million copies if it was an American book for the American audience, compared to the size of the population, translated into 7 languages. So it has really transformed my life from what it was before, just when I was just a normal doctor.
That's fabulous. Congratulations. And having gotten to see some of the book and your work, I think it's great information. So I'm glad it's getting out there and more people are reading it. And one of the things that I really like about your description and your approach is that there's this difference between leading indicators and lagging indicators. If someone, like, for example, someone is having health problems and they don't know anything, and then all of a sudden one day they have a heart attack, that's a lagging indicator, right? That's already happened. Whereas if you can look at leading indicators, like, of course, people look at their cholesterol and inflammation levels and can measure vascular stiffness or pliability or flexibility, different measures of health of the vascular system and blood flow, et cetera, and things like that. So there's different time scales. There's sort of, you can look at things in real time. You can look at things then over, you can get your recovery score in the morning, which sort of gives you the sense of the picture of the day before. You can get your quarterly or annual blood tests. And so one of the things that I like about this is the opportunity to have a little closer to real time, which I think is cool here. And so I want to, just before we dive into the discussion, want to make sure we're all speaking the same language, understand the terms. And I've heard different people describe heart rate variability in subtly different ways. So can you describe, give us your definition, your understanding of heart rate variability, and then we can dive in from there?
Yeah, so heart rate variability is what it sounds like. It's the variations between heartbeats. So when we are in it measures different things. It measures the state of our autonomic nervous system, which is divided into 2 parts. This is an ancient system that we can find in all vertebrates. So it's kind of hundreds of millions of years old, maybe 300 million years old. So it works pretty much in the same way as it has done throughout the ages. And it has a sympathetic part that mobilizes us from something that is hunting us down or to something that we are hunting or gathering ourselves. And it has a restful parasympathetic mode, which balances the stressful mode, which is called the parasympathetic mode then, and is the recovery phase of our autonomic nervous system. And the really, really cool thing is that our heart rate can reveal whether we are in the restful state or in the stressful state. If you are in the restful state, when we breathe in, the heart rate will go up a little bit to take advantage of the extra oxygen in the lungs. And when we breathe out, the heart rate will go down a little bit just to relax and save some energy. It doesn't stop, of course, but it slows down in a measurable way for our devices. And if we are in the stressful state, from whatever reason, whether it's a mental stress, whether we have eaten something we cannot tolerate, whether we have had alcohol, whether for women that it's the PMS period before they get their menstruation, and a host of other surprising things that can affect it. If you're in the stressful state, the heart rate will beat at the steady pace, regardless of the breath. And this is the way that these wearables can track our stress in the moment and accumulate it throughout the day and week and year so that I was asked a question yesterday, and I could look at my Garmin watch over the last year and can see my average stress levels over 12 months. So you can see it in the moment and then see if this is sustainable, because so many of the diseases that we are treating as doctors today has its basis in too much stress compared to our capacity. So, and it will lead to a chronic inflammation, so a low-grade chronic inflammation that will manifest itself in all the different organs of the body. So it's the same root cause of a lot of brain disorders, neurodegenerative disorders, heart disease, cancer, autoimmune diseases, and so much of what we are struggling with. So it's a really, really important thing to have control of. And the really good thing is that now I see you have a Whoop band on your hand, on your wrist. And Cristiano Ronaldo, the soccer player, says that this is like having a doctor on your wrist. And I totally agree. It may be even better than having a doctor, because these are devices that can tell us something about preventative healthcare to help you to avoid getting sick. Because the strategy around the world in the healthcare system is to wait until you get sick and then to do something. And the problem is that there's too much money in sick people and treating them with suboptimal medications. We don't really have good medications for these lifestyle diseases. We can dampen them a little bit, mask the symptoms a little bit, but we cannot really cure it as we would want to, like we can with infectious diseases, like like pneumonias and urinary tract infections and so on. So that's why I think this is really, really important devices. And surprisingly enough, that my book, The Pulse Cure, is the first book on how to use these devices connected to lifestyle strategies and optimization, somebody would call it, of health. I would rather call it normalization of health, so that you have a normal health that is not in your way and allows you to live as long as you're kind of meant to be, according to your genes. So that is my explanation of this.
I like that. Yes, normalizing. Uh, it's what we think of as normal is, these days for many of us is just what's common, which is rampant lifestyle disease and all that here. And I love your perspective. I think it's great to hear that, what you say there about the strategy really is to wait until people get sick. And, if we can be more proactive, it's great. Just sort of piggybacking on this theme that we've both talked about there, sort of leading indicators versus lagging indicators. Another example is, for many of the practice owners out there, if you run a business, you have a practice, and you wait until the end of the year to look at your profit and loss, you might be surprised that you've made, or even worse, if you've lost money, right? The equivalent of getting a bad health outcome. But if you're tracking week over week, how many sessions you're seeing, what your capacity is for your staff of therapists, how many new leads and new opportunities with patients you have coming in, what the conversion rates are, if you're looking at that over time, you have a much better chance to get to that better outcome at the end of the year. So just at the risk of being repetitive, just another example there. So
Yeah, and what these devices do is that they give you an insight into the physiological budget in the same way that you're talking about the economical budget, so that you can see what goes in and out, what repletes your energy stores and what saps some of your energy, and everybody will get a surprise. I'm sure from the Whoop band you've had your surprises on what can affect your recovery in the morning.
oh yeah, for sure, for sure. And I definitely want to talk about that and talk about the differences between, you've mentioned the Garmin, of course, the Whoop, and some of these other ones. What, just in terms of your overall approach, what are some of your top of mind favorite examples or applications of this information? In other words, sort of most impactful or powerful scenarios where you get this information from a device, and then it allows you to make a change, and then you can see improvement there, just to give people a sense of sort of how these concepts apply in day-to-day life.
Yeah, what usually is the biggest shock of most people is the effect of alcohol. And according to Whoop, that tracks their users because you put in the information about what you have been doing, alcohol is the worst stressor of all the stressors. So most people get a surprise. And according to Whoop, it takes 5 days after you had, like 3-4 glasses of wine until you're back at the same recovery that you were before those glasses. So it's not just the day after, but it takes a long time to get back. And that is what I used to have to calm myself down. So that shows how little insight really have into this. And I'm a doctor. So what I used to do after a busy day at work and busy life with the family was having 2 or 3 glasses of wine in the evening to wind down, thinking that this was a good strategy to calm myself down. But when you have the monitors, you see that that's the very worst strategy that you could have. So even going from what you think is the best that proves to be the worst, and in between there are so many results about what I cannot tolerate that I have discovered through these wearables. Like I cannot tolerate chili, I cannot tolerate the strong kinds of mustard, I tolerate bakery goods really poor, milk, things like cakes and ultra processed food, for example. And
So let me pause you for a second. The first one you said was chili, like chili peppers.
yeah.
Okay. Uh, and so when you're looking at this, I think, because I think this is just wonderful information here. So the effect of alcohol, that's more like your overnight recovery and sleep and things like that. But when you say you can't tolerate these foods, what's the time scale in which you're seeing those
Yeah,
reactions?
I can see a quite immediate reaction. I can understand as I'm eating and the problem with chili is that it's never marked, or very often not marked, because people are not allergic to it. That they could get an anaphylactic reaction. So they would put chili into anything to make it taste better. And so often I will be there eating something that I had no idea. Some days ago I had a Caesar salad that they put chili into. I've never had that before. And then I can just feel and see immediately on my watch that, okay, there's something more here. My heart rate goes up maybe 15 from 60 to 75 in a matter of minutes. And the stress will stay there maybe for 3, 4, 5 hours into the night. And depending on the dose, it can totally wreck my night. So, but unlike alcohol, I'm pretty much back, the day after. But alcohol can stay in longer, have a longer effect. Yeah.
And so one question, part of this question is just the details. I haven't used the Garmin watch, right? I've used Whoop and Oura Ring over the years, but you mentioned your pulse rate increasing. So we're talking about both your resting pulse increasing, which indicates your body's under stress.
Mm-hmm.
And then are you on the Garmin watch, are you seeing both increases in pulse and decreases in real-time heart rate variability? Or
Yeah, but Garmin has translated the heart rate variability into a stress number from 0 to 100. So I would see that my heart rate goes up and that my stress levels go up maybe to the 80s. Where if I had a Caesar salad without the chili, it would be low. It would be maybe 30 or 40. Any meal will give a certain amount of inflammation. So it's just a matter of identifying what gives a larger amount of inflammation. And this way you can see that you cannot tolerate this food. And interesting enough, I was working on my next book, which is just released in Norwegian, called The Rest Cure. And I was on a podcast and somebody told me that a doctor named Dr. Koka, a bit suspicious name maybe, but he found out in the 50s that you could use the pulse. He has written a book, The Pulse Test, about how you can identify food intolerances by monitoring your pulse. Of course, then you didn't have any devices, but that you could, feel the pulse yourself and check it and note down the reaction after a certain food intake. So it's not a new concept, but the good thing is now it's easy to find it. You can see it quite clearly if it's something you react strongly to.
Yeah, that's awesome. I think that's a wonderful use case. And if you think about it, if your body has all that extra stress from just reacting to having and mounting an inflammatory reaction against this meal, think about how many resources that's taking and how much fewer resources are left over for long-term growth and repair, for higher level cognitive function, right? If you have that meal for lunch and you have to go be in a meeting and be mentally sharp in that afternoon, you're going to be
Yeah,
it's going to be problematic, right?
absolutely. So I have learned, before I'm having a lecture or a presentation, for example, to have a light meal and not think that maybe I would used to think that now I need a lot of energy, so I need to eat a lot of food to have that energy. So now you can see that is totally different. That is better to eat a lighter meal. Uh, that's important. And also, what a lot of people find out is that late night meals is very bad for your stress levels. So most people find out that they want to stop eating their last meal maybe 3 or 4 hours before they go to bed.
Yeah, that's a good tip for virtually everyone, virtually all of the time.
Yeah.
That's very good. So I like this. This is one example here of how you can use this information to really drive decision making and behavior, is to see the effects of foods in in near real time. Are there any other sort of top
Mm.
of mind, just really powerful, impactful examples where this information can really influence decision making?
Yeah, it's a lot easier to motivate yourself for cold water immersion, taking cold showers, doing cold plunges, because you can see the effect that is calming the nervous system, not while you're in the exposure, but afterwards you can see the effect on your heart rate, which is, of course, why a lot of athletes use cold water to dampen the inflammation caused by their activities. Particularly in technical sports where you want to be a lot on the pitch, like a soccer player, for example, you want to go into the cold afterwards to get the inflammation down so that you can do more practice the day after. So, and that is motivating to do the hard things, to stay away from alcohol when you see the effect, to stay away from certain ultra processed food that is hyper palatable, that you kind of get addicted to, that is tastes so good. But when you see the stress levels afterwards, you kind of lose your appetite for those food stuffs. Yeah.
Yeah, I find that with my continuous glucose monitor too, which if you're listening, you don't see,
Mhm.
but if you're watching, you see I have one on my arm too. It's another similar approach in the sense that it gives me more immediate information. Instead of waiting to look at my
Mhm.
hemoglobin A1C 3 to 6 months from now on my next blood test, I can have a better sense of,
Mhm.
how my blood sugar levels are day to day and what's influencing them and things like that. So
Mhm.
um, I like that you mentioned cold there, and I think that's a great segue into this topic of coping with stress management, etc. I think a lot of people just have sort of a immediate knee-jerk reaction to say we don't want stress, but you just gave an example where getting into a cold shower, a cold tub is immediately stressful, but it reduces inflammation. So it ends up over the course of a day reducing the overall stress load or allostatic load on the body. And then it also, I would believe and want to hear your perspective on this, by teaching us or by giving us an opportunity to practice being in a stressful circumstance and intentionally calming down, right? When your brain is saying, "Oh my God, we're gonna, panic, panic, we might die," because you're in water that's that cold. If you are able to calm your breath down or calm yourself down, using your breath, using the power of your mind, I think there's a really cool opportunity to learn that skill of being able to actually handle more stress or increase your capacity for stress. So, I like this metaphor of the
Mhm.
the stress bucket where you can, you have a bucket, and as you put various stressors in, some might be injury, might be exercise, might be foods where you have a sensitivity, might be poor sleep, might be job or relationship stress. And then once it fills over, once it gets past a certain amount, you typically have some sort of pain, some sort of symptom. And I think there's sort of two ways to approach this. A lot of people think of they need to reduce stress and take things out of the bucket. And yes, that's true. Like you just talked about eliminating foods that are inflammatory, where you have a sensitivity or reaction. And yes, you want to do that, but we don't necessarily want to empty the bucket, because we still want to exercise, do things like cold exposure. So we want to, we want to also find ways to sort of increase the size of the bucket. So I'd be curious to hear your
Hmm.
perspective on stress and how you discuss this, how you coach people on this whole notion of, quote unquote, stress management.
Yeah, you're totally right. So you're talking about here, of course, about hormetic stress, voluntary stress that pushes you and builds resilience, builds your powers, increases the size of your bucket so that the same amount of water would be easier tolerated. And also that if you refrain from stress and get too fearful about stressing your system, your bucket will be smaller and smaller because and tolerate less, of course, then. So this is a matter of building yourself physiologically, building your VO2 max, building your muscles, straining yourself with challenges mentally and physically. Sorry. So when you have done that, you can tolerate more both of mental and physical challenges later. So one of the best things to be able to reach a calm state is to have a good VO2 max, a good physiology, good capacity for movement. So then your body works at an easier pace in your daily life. So that's a very important part of it, just as you mentioned. So yeah, I would, and you don't need that much of an effort. If you do 4 minutes a day, where you're kind of going up to 85% of your maximum heart rate, that should be enough. That's 4 minutes a day, 1/2 hour a week, is shown in studies to be enough to have a good, healthy capacity. So you don't have to go all in and go to the gym or whatever. You can run on the spot, as fast as you can for 4 minutes, and you're done. And you can probably even do it in two-minute sessions during your working day. And the good thing about it is that when you do this, the improved circulation in your brain will make it easier for you to concentrate for an hour or two afterwards at work. So it's a win-win situation. Yeah.
Yeah, I love that. I'm so glad you brought that up too. The more robust the cardiovascular system is for delivering energy, and the stronger our muscles are, the less challenging just daily life is. And so there's more bandwidth or more capacity available to deal with other stressors. So I love how you describe that. In terms of this notion of stress management, of taking offending things out of the bucket and building the size of the bucket, you've already talked about some of them, but you have this list of the 8 most impactful levers you can pull for managing stress and
Mhm.
most effectively optimizing health and longevity and all these things. So can you talk about some of these other strategies that are in the list here to make sure we round it out for everyone listening?
Yeah, so what you're talking about here is the big American study on American veterans from the Army or Navy or the armed forces anyway. 700,000 people, they've been followed for somewhere around 15 years. And they have seen that if you have the lifestyle strategies that are more or less the same as I'm describing in the Pulse Cure, then we're talking about that they get 24 more years of lifetime. If you do them compared to that you do not do them or do them in the wrong way. So that would be to have good relationships, to have a good nutrition, to be physically active, to do not drink alcohol in excess, to do not smoke, to sleep well, and not to use opioids. And there's one more I can't remember at the time. Yeah, that you have some way of stress management to calm yourself down. If you can check on all these 8 different parts of your lifestyle, then you live 24 years longer than if you can check out that you don't do it, that you have poor relationships, you do smoke, you do drink too much alcohol, and so on. So there's a lot of extra lifetime to be had of healthy years of health span. And that is the reason before my father died, I did not care so much about my own health, because from what we learned in medical school, we had the impression that if you did everything right, maybe you lived for 3 or 4 years longer. I did understand that. But doing that would take 3 or 4 years. If you would sleep 1 hour extra, from your 40 to your 80, that's 2 years. If you would do an hour of exercise, another 2 years, and there it went. Why bother? You wouldn't gain anything from using that time. And now, of course, now that we know that it's 24 years extra, then it's a totally different the budget, so to speak, that you can take into consideration. So I'm trying to do some effort in all these different kinds of lifestyle where I was not focused on that before.
That's profound to think. 24 years. If the average life is something like 70 to 80 years, that's an extra third.
Yeah.
An extra
Yeah.
33%.
Yeah, and that's also my clinical experience, from seeing the patients, because I see patients from before they're born until after they're dead. I write the death certificates, that's part of my job. And I can clearly see that the average, at least the average Norwegian would be 80 years old, somewhere around that. And if you do all of those things wrong, you will be lucky to get into your 70s alive. If you do all of these things that I mentioned right, you may well live into your 90s and still be vital. So I can also see that it has a real life value. It's not only statistics from a research; it is how it's how we live.
Yeah, that's a profound difference to think that someone can be 2 people can live the same 70-year time chronologically and just be in totally different states depending on their choices here. So I think this is wonderful. What's your message, because it'll motivate people to.
And the good thing is that it's free. All of the strategies that I'm talking about in the Pulse Cure is free. Moving, sleeping, cold exposure, breath work, eating whole foods and not stay away from ultra processed food, and getting enough sunshine. So all of these things are free. Getting out in nature, for example. So it's accessible to anyone, regardless of your bank account and wallet. It's only after you get sick, and of course, particularly in the United States, in Norway, healthcare is free. And it's after you get sick, that is when it depends on your wallet and it becomes really expensive. So for so many Americans, it's like you have been working your whole life until you retire, and then your disease gets away with all the money. So it's a depressing. But you can avoid that. We have more control of our health than we were taught in medical school. And the good thing is that we now have these devices, the wearables, that can help us along the way. And what it does is it takes the power out of the hands of the doctors and the healthcare system and put it into your hands, quite literally, so that you're able to take control yourself. And it will take an effort. You're not getting away from the fact that it takes some effort to be healthy and alive. And you have the choice between a planned, conscious effort to do these lifestyle strategies, or you can hope for the best and do not do that, and then it's out of your control. The effort of being sick is so much larger than your what you do to stay healthy. and then it's out of your control. It depends on the quality of your doctor, of your insurance, and so on. So I would, of course, recommend people to do some effort to stay healthy before they get sick.
Yes, and I think one of the reasons that I appreciate you sharing that perspective, your former perspective on thinking that these efforts would take as much time as they save you, and it's sort of a zero-sum game. And I think a lot of people who aren't as motivated to take charge of their own health, they may not realize that many of these most powerful changes they can make are low or no cost, like you said, and two, perhaps even more importantly, that they actually can make a big difference, that it can mean a difference of 24 years rather than just 2 or 3. So I'm glad you shared that, because I think that's really inspiring. And I also, I do want to just shift for a moment. For many people listening to this, you are physical therapists, chiropractors, athletic trainers. You're working with people for more musculoskeletal considerations. Of course, you're likely interested in your own health and the health of your patients and clients. However, I do want to hear your thoughts on specifically, Dr. Færø, on the connecting the dots between heart rate variability, stress, and injury, recovery from injury, anything in this sort of musculoskeletal realm, and also we can, after we do that, can pivot into athletic performance as well.
Yeah, so heart rate variability and sleep quality, in addition to that, I would say has so much to say on your risk of getting injured. I've heard on podcasts some sleep experts and exercise experts say that if you have good sleep, that is the most important thing you can do to avoid injury and having a good lifestyle. This is why probably the soccer players are not so famous in the US, but the best soccer players like Erling Haaland, the Norwegian, and Cristiano Ronaldo, they're very particular about their lifestyle, about what they eat, and how they can have the best possible heart rate variability. Both of them using the Whoop band, actually. So following the heart rate variability, I think, would be very, very important for the practitioners that you mentioned. They should also really pay attention to the VO2 max level, because what I can see from the VO2 max level of the people who contact me is that if you have a VO2 max of maybe 30 or even lower than that, you cannot tolerate that much exercise, and you would be full of lactic acid very quickly from very easy strains, that you would think is okay to go jogging or running or doing some exercise. And then you can see from your monitor that it will affect them for days, create so much inflammation. So you should really know, or try to know, the VO2 max of your client, at least if you are doing exercise and endurance training and strength training and so on. So preferably you would have, maybe 40 in VO2 max. Then you have a lot more resistance and can train much harder. I think many people are surprised of how little exercise they can do if they have a low VO2 max. And if you have never exercised and you are 40 or 50 years old, it will be really low. So I think that's an important point.
Yeah, for sure. And then also, just closing the loop on one of the things that we talked about earlier, like you mentioned, the levels of inflammation you have after you have offending foods, right? Inflammation is part of their rehabilitation process, and the acute inflammation. We want acute inflammation, is good, is protective. Chronic inflammation, bad, harmful, right? So, I think also making sure that the higher someone's VO2 max is, and the higher their heart rate variability is, the more bandwidth they have, the more resources they have to recover faster from injury. Because a lot of, it is like a construction project. You have to, digest, break down, absorb amino acids, bring them to, clean up debris, bring these raw materials to the tissue there, and you just have more bandwidth to be able to do that too. So I think that's just Just one
Yeah,
other
I
thought
think that
to add
because
in.
Thank you so much for listening to the Undercurrent podcast. If you're interested in learning more about how NeuFit and the NeuBeat can impact your life, please visit our website at www.neu.fit, that's neu.fit, so you can learn more about how it might integrate into your professional practice, how you can use it as a patient, and you can also connect with our team there.
Yeah, because it seems to me that the energy in your body is kind of a no zero-sum budget. So if you're putting a lot of strain on yourself or you're dealing with an inflammation, there is less energy for the immune system to do its job. So if you keep drinking alcohol, creating the inflammation from the alcohol, for example, you would be more prone to get an infection afterwards as a sign that your immune system is not working optimally. So it seems that the energy for the immune system is what can be pushed. So for example, it's comparable to a business that if they're not making as much money, what they will cut down on the costs, it's not necessarily the wages or the electricity bills, but it's the maintenance that will be postponed until they get the money to do that. It will be the least priority. And our bodies is just like that. If you're in the stressful state, in the survival state, the sympathetic state, then we can always push back the immune system and just keep the circulating cells out of the circulation. So, but over time, if you are in this chronic state of stress over longer time, and then I'm talking about as little as 2 or 3 months, it can increase the chances of you contracting a disease that you really don't want, like cancer or heart disease and different diseases, when your immune system is not really given the means or the circumstances to do its job properly.
Yeah, I think that was beautifully said. Thank you. Thank you for sharing that. That's right. The maintenance is sort of going to be the thing that's sort of left until last, those longer term growth and repair projects. I think that was beautifully said. I would like to move now into talking about some of the wearables. We've already talked about the Garmin, about the Whoop. You mentioned the Garmin gives you that 0 to 100 stress score. The Whoop has a real-time stress score too between 0 and 3, which is a similar combination of heart rate and heart rate variability. So there's some of these. What are your thoughts on any other favorite tools, or what people should look at? Whether should they think about? Is it basically get a Garmin or a Whoop? Do you see success with an Apple Watch? What are your thoughts generally on recommendations for these various wearable devices?
Yeah, I think that all the smartwatches will have some way of making an estimate of your stress balance. And all of them are way better than your own guesswork. So it's a huge leap forward, from having no clue about what's going on inside your body until having some clue. And I must say, before I say more of this, that the reason why we cannot feel our stress levels is because of the evolution. Throughout history, all the threats to our health came from the outside, came from other animals, from human enemies, or the monkey human that we were before, or it came from foul food or the water that was contaminated and such things. That we have excellent eyesight, excellent hearing, excellent taste of smell, and if there's a little rock in our shoes, we can feel it immediately. But the state of our own stress levels we cannot feel. Whether I now at this moment have 60 or 80 in heart rate, I have no idea. And particularly not if you're living a busy life. You have no sense of your own stress levels until it's really, really bad. That you may feel. And it's not only that this sense has not been developed, but it has been muted. Because if we could feel this stress, it would disturb the senses to the outward threats. And it takes, millions of years to develop a good sense. It's not something that we can have, for the last 50 years, because it's not only in the last generation that the stress level has become such a big problem that it is now. And using these wearables is like having a substitute for this sense that we never needed to develop. So it's kind of helping us to see what is otherwise undetectable by our nervous system. And then there will be different devices according to different needs. So everything is better than nothing. But I would point out that the Oura Ring would be really good, and particularly if you have an Apple Watch or like a standard analog watch that you also have. The Oura Ring is not so intrusive. It will give you a recovery score in the morning, a sleep score. It will show the heart rate variability, your temperature, and so on. It will also give you a stress score. You can have some meditations on it. It's a kind of its own universe. So many people would prefer having an Oura. It's not like with a Garmin, when I can at any moment see my stress levels. For some people, that would be too much. So now I can see that in the moment, my stress level is 33 on a scale from 0 to 100. So that's fine. And my body battery is 31. So the body battery is something that Garmin has developed in collaboration with Firstbeat Analytics, a Finnish company. And that shows you your physiological resources, or an estimate of your physiological resources, so that in the morning I try to have 80 or more in body battery in the morning. And I try not to go lower than 20. That's kind of the sweet spot, the zone that I find that I work, and most people work best in that zone. And it will also show the heart rate variability over time, so you can see if you're overtraining or if there's, if you're too stressed, you will be able to see that. So for micromanaging your stress levels and finding out the exact cause and how much, like we have been talking about, then I think it's only at this time, only Garmin that can help you to do that. And of course, now I have also a Samsung watch on me, a Samsung Galaxy Ring. I just had it for a few days, so I'm comparing different wearables, but they also seem really good. And what Samsung seems to be better at is to employ artificial intelligence in their devices so that they can, and that is, I think, is a future of these devices, with these biometric numbers that you get from temperature, movement, the heart rate, your oxygen levels, and so on, and connected to artificial intelligence, with information, about kind of everything in the universe. That will be an extremely powerful tool. So I can see that in this area, the development is so fast. And I'm waiting for the Whoop 5 that should be around the corner. I think the Whoop 4 that you have and I have is kind of 4 years old or something. So I think that they have the Whoop 5 just around the corner. It should be out this year, I would assume. And then probably that will be another game changer as well, maybe. So it's so interesting to be a part of this, the development of these devices that can help us stay healthy, that there's money to be made in keeping us healthy and not only treating us after we got sick. So that's I'm very optimistic about this.
Oh, that's beautiful. That inspires me and has me feeling optimistic too. I love how you said that. One other just also comment that I have to make, when you talked about your body battery wanting it to be 80 or greater in the morning, not getting down below 20 during the day. So my master's degree is in engineering. So I was, doing engineering school, ended up going back to another program in neuroscience focusing on motor control, and that was a segue into what I'm doing now. But when I was in my engineering program, there were several people in my lab working on batteries, and so I took a course in some of these electrodynamics of batteries, and there's actually an interesting phenomenon where if you fully charge and discharge a battery, it will lose its life faster. You might get, say, 500 cycles of charging. If you go, and the numbers were go up to 80 and go down to 20, you might get 500 cycles. But if you fully charge and fully discharge, you might only get 250 cycles. The life might only be half as long. But it's so interesting to hear you use those numbers, because those are actually the same numbers that are recommended in the use of physical batteries. I just thought that was a cool. I don't know. Cool.
So it's probably a bit like that. In we want more of these cycles, So it's a good thing, and it also makes it easier. My mother at 82 understands this, So the graphs that you see, where it's blue in the parasympathetic mode, and is varying degrees of orange to red in the sympathetic stressful mode, makes it very easy. My teenage daughter has been using it since she was 14, and my older mother used it. So they're able to convey the stress level and it's also kind of a gamification. So a lot of people wonder, paying attention to your heart rate must be very stressful. And I know that will be people that has not done it, because once you start doing it, you can see that it's more like a game, that you get scores for how much you have slept, and you can see your stress levels, and it gets really fun, and it's your own life and health that is at stake, and not just an avatar in a video game. So it makes it more important also, of course. So so most people think it's fun.
Yeah, I agree. When you were talking about your stress score, I looked up mine on my Whoop. I'm at 1.3. So 0 to 1 is low, 1 to 2 is medium, 2 to 3 is high. So I'm just hanging out here having a conversation. I'm also at my standing desk, so just low to moderate. It seems reasonable. So that was cool. And then I think one thing that definitely jumps out at me is you're mentioning, when you haven't slept as well, even just for one night, let alone multiple nights, the risk of injury, how that goes up. And so being able to use these to, figure out when is the best day to really push yourself versus when might be a little bit of a lighter training day, and all that, can really factor in here. And as we wind down, I want to ask you just two quick rapid fire questions, as someone who lives this stuff day in and day out. You don't just I like that you walk the walk and don't just talk the talk too. So I'm curious, what's one daily habit that you never skip, that you really pay attention to in light of this conversation?
Yeah, actually, what I do every day now is red light therapy. So every morning I put on the big panel, and particularly now in the winter, of course, in Norway, the sun is barely above the horizon, So that is what I think is important. And it's actually, my next book will be the sun prescription, about how we can use light and sun exposure for the benefit of ourselves, because it's just a huge shame, I must say, that the medical society and doctors and healthcare system has been warning people of the sun, claiming it's dangerous. And it seems that there's so many benefits in our cells from sun exposure. It seems to reduce the chances of getting heart disease by almost a third. And it seems to be reducing the risks of cancer of all causes by 15%. And it doesn't seem to increase the death from melanoma almost at all. So I think that's the change when it comes to sun exposure. So but in the wintertime, I use the red light. Red and infrared light. Yeah.
I love that you said that. I've come to see, of course, nutrition is a matter of getting, the right nutrients frequently enough, those inputs. I've come to see also movement and light exposure as forms of nutrients, wanting to make sure that I get enough of the good nutrients in, enough movement not just during a formal exercise period, but, movement during the day too. So your tissues stay fluid and loose, and your nervous system stays activated. You move your lymph around, and also with light exposure, getting getting that in is like a nutrient. It does a lot. I'm so glad you said
Yeah,
that.
it's intravenous energy. You don't even need a needle for it. So
Yeah.
it's of course it's pure energy. It's pure electromagnetic energy that we otherwise take into our bodies, transformed through plants and animals, and then we digest it, and then it comes into the cells. But the sunlight in itself is energy, and it will increase the ATP production in our cells. It will release nitric oxide from our skin and improve the blood circulation. So researchers mean that there are hundreds, if not thousands, of processes in our cells that have used sun for the benefit of the cells for, of course, all these 4 billion years of evolution. So it should be an obvious thing. I'm looking forward to start on that book. Yeah.
Fabulous. I'm looking forward to reading it. And speaking of books, one last question for you. With everything you've learned, everything, I'll be curious to this. Is there a top, most impactful, best book that you've read in the realm of health and performance? Or, if you can't pick one, your top 2 or top 3, but what stands out to you as sort of, best books outside of the Pulse Cure, your own book?
Yeah. I would say maybe Why We Sleep from Matthew Walker, the best book on sleep, because that's the most important thing. If you can just get your sleep in order, you come a long way. And of course, there are many things affecting your sleep, but and one of the best things about these wearables is that they can assess the quality of your sleep. So I would say that book. Yeah.
That's great
And
answer.
and also my book is also available as an audiobook. That could be useful because many podcast listeners would rather listen to a book than read it. So it's of course an ebook and a paper version as well that you can get through Amazon or anywhere probably.
So that was part of the answer to my next question, which is for people that want to read your book, learn more about you. What are the best places to go? So Amazon for your book is the Pulse Cure, audio and Kindle and paperback on Amazon. And then can you tell us other websites, other channels, the kind of best places?
We have a website called thepulsecure.com it's a social website that we're building right now, but it's possible to see a blog there. I have a video lecture that you can see for free, where I can explain things that I've been talking about now, and you can see the graphs, and probably more easier to explain it when you see the graphs as I speak. Yeah.
Awesome. Well, Dr. Fierro, thank you so much for the work that you're doing, for coming on to share it here with our community. And if you do come to that show in Austin, I'd love to meet you in person.
Yeah, I would love to come to Austin. Yeah, I've been there before. It's a great place. So I hope I will be able to, if not for that conference, but at some point, I hope.
Awesome. And perhaps we'll find a way to get over to Norway too. So
Yeah.
Thanks again for coming on the show. Thank you everybody for tuning in and listening to this episode of the Undercurrent podcast. We appreciate you and see you next time.